Hello, I'm so excited to be here today. Today, we are going to talk about another common cause of heel pain. Although it is not even close to as common as plantar fasciitis, it is a problem we commonly will see, and really is usually described as pain not on the bottom of the heel, but on the back of the heel or even the back of the ankle. So let me give you a little bit of background. When you look at the heel, as you remember, the Achilles tendon attaches on the back, and you can actually have pain in the Achilles tendon and get an Achilles tendinitis. So Achilles tendinitis will be either localized right to where the Achilles tendon attaches, which would be typically caused by a heel spur, which we will talk about tomorrow, or it'll be to the outside of the heel, and usually we'll have a bony prominence in that area or prominence in that area that's rubbing on shoes, and it's called a Haglund's deformity, which will also be discussed tomorrow in our video. So with Achilles tendinitis, typically it's going to happen a little bit above the Achilles tendon in an area called the watershed area. This is the most common area to be injured in the Achilles tendon because of the blood flow there and because of the location. It's actually the weakest portion and is the most common area to get. Really, really painful. So why would you get an Achilles tendinitis? What would happen? What would be the cause? Really what it is, it's a strain of that Achilles tendon. That can happen from overuse. So maybe you ran too far or hiked or did something that you weren't used to. Maybe you wore a poor shoe that wasn't supporting your foot like it's supposed to, and it was causing a little bit of extra stress. If you're an individual that's always in high heels, for example, and you will go barefoot, you can create an Achilles tendinitis if you walk for a very long period of time, because over time, because of wearing heels all the time, your Achilles tendon is shortened, so you're stressing it when you actually have to walk normally. So if you have a tight Achilles tendon, you're wearing bad shoes, overuse injury, all of those can cause an Achilles tendinitis. You could also even have an Achilles tendon injury like a tear or something like that that would have a similar presentation, similar type symptoms, though it usually is a little bit more if you have an Achilles tendon tear. So how would you diagnose it? The easiest way to diagnose it is first to touch. It should be localized to the Achilles tendon. Sometimes when you've got the Achilles tendon right here, you'll have pain in the front of the Achilles tendon. If it's in the front of the Achilles tendon, it could be an Achilles bursitis. There's a bursa that sits right in front of the Achilles tendon in that area. And because of that, you can actually get a discomfort in that area. It's treated the same, and often will be resolved a little bit easier even than Achilles tendinitis. So we won't discuss that at this time. But with an Achilles tendinitis, you really need to help, one, find the cause and say, okay, I need to make sure I don't cause it again. And then you need to work on getting the inflammation and the pain gone. So as we talked about with plantar fasciitis, there are several different ways that you can get rid of inflammation. One is icing the area. If you take the stress off of it. So sometimes if the Achilles tendinitis is bad enough, you may need to go into either a boot where you're not stressing that Achilles tendon at all, or a heel lift that takes the pressure off the Achilles tendon to give it time to heal. Healing usually takes anywhere from 4 to 6 weeks, though sometimes you can shortcut it and get it better a little bit faster if you're doing the right things. So with resolution, then you say, okay, I need to get rid of the cause. So if you're a tight Achilles tendon is the cause, you need to stretch it out. If a shoe is the cause, you need to get rid of that shoe or find a way to adjust it so it doesn't cause that again. If it was an injury, you need to figure out why and work on making sure that injury doesn't happen again. So you have an Achilles tendinitis. We diagnosed it by location, say, oh, that's where it hurts. And then we do an x-ray. The x-ray actually will show you not the Achilles tendon itself, but it will say, do I have a bone spur or a heel spur or calcification that's going to cause this pain? Because those have different treatments. Or do you have a bony prominence in the area of the Haglund's deformity? Again, we'll discuss that tomorrow. That could be causing your pain. Those are both seen on x-ray. But to really look at the Achilles tendon, you need to do either an ultrasound or MRI. Ultrasound can be done in the office, and so typically that is what we do, and we will actually look at the Achilles tendon and say, okay, is there inflammation either around the Achilles tendon or in the Achilles tendon that is consistent with an Achilles tendinitis? And if there is, then we work on treating it. As opposed to plantar fasciitis, where you can treat an inflamed plantar fascia with a cortisone shot, I don't recommend cortisone shots for an Achilles tendon because there is a possibility that you can actually weaken a tendon by giving it a cortisone shot. And if you weaken the strongest tendon in the body, you increase your chances of getting an Achilles tendon tear. So I will not ever give an Achilles tendon cortisone shot. So you need to find another way to decrease that inflammation, whether it's anti-inflammatories, ice, or even the MLS laser that we discussed with plantar fasciitis. With MLS laser, you're going to decrease the pain, decrease the swelling, and the big advantage is you will cause healing. So the Achilles tendon will heal. Typically, we'll reduce a period of time from 6 weeks for recovery down to 2 weeks for recovery. With that significant improvement, a lot of times you can continue even doing your activities and still get the Achilles tendon to recover. Once it has recovered, like we said, you need to work on getting rid of the causes. So if you have pain in your heel, and it's not localized to the bottom of the foot, but it's localized to the back of the heel or even the back of the ankle, it could very well be Achilles tendinitis and should be treated as such. It should be treated by getting the inflammation out of the Achilles tendon, reducing the cause so it doesn't come back, and then getting back to normal activities. This is Dr. Brandt Gibson, and this is day number 4 of your podiatry ideas. The whole process is going to take about 30 days to give you as much information as I possibly can while you are separated from other people, so you can actually learn and say, I can take care of my pain, I can take care of my problem, and hopefully get better. If you aren't finding a solution, I recommend that you find a specialist, that you find someone that knows about Achilles tendinitis and knows the treatment options and can help you find a true solution. This is Dr. Brandt Gibson.